Hi everyone, this is Dr. Sharadi Shreemoyee from Rejuve Aesthetics, Guwahati, and welcome to my YouTube channel. We all have suffered from acne at some point in our life. Some of us might have had one single pimple in our entire life, while some of us might have suffered or are still suffering from bouts of acne from time to time. Acne is a cause of major distress and self-esteem issue in most young adults. Most people suffer from acne in their teenage, barring a few fortunate ones, while there are many people who still suffer from it well into their adulthood. If you're one of them, then this video is for you. What causes acne? Why do some people continue to have it in their adulthood? And how to deal with it? In this video, I will be discussing this and a lot more. Keep watching till the end. Welcome back. Acne is something which is common in your teenage, but we see so many young adults, people in their 20s, 30s or even 40s suffering from acne, which is quite distressing. Every time you have an exam, stress, a job interview, you have to go to an event, a family function, pop it goes. There comes your pimple. Normally, in teenage, acne is very common as our body is going through a lot of hormonal changes and it manifests as acne on our skin. It can be on the face as well as on other body parts such as the chest, back, etc. This type of acne usually goes away as we reach adulthood, which it does in most of the people. But in certain section of people, or I should say another section of people, it stays much into adulthood. In fact, we see many people who have never had acne in their entire teenage and as suddenly it starts appearing into your adulthood when you're in your 30s or late 30s or your early 40s. What is acne basically? How does it form? We have sebaceous glands on our face and body. So when our sebaceous glands get blocked due to accumulation of dirt or they get inflamed due to some reason because of any kind of stress or because constantly when we are touching our face, the bacteria gets accumulated and it blocks those glands and forms acne. But why does it happen in some people and not in others? So there are some predisposing factors because of which we develop acne, especially in adults. Let us have a look at them. Number 1. People who have an oily skin have a tendency to develop more acne because their skin attracts more dirt, which in turn causes clogging of pores more than the rest of us. It is not like people with dry or normal skin do not develop acne, they do, but people with oily skin are more prone to it or have more of a tendency towards it. Number 2 is genetic tendency. Yes, your acne can be inherited. When your father, mother, uncle, aunt or anyone in your family have had a history of acne, you tend to inherit it and you have the tendency for it. Number 3 is the hormonal tendency. This is more relevant in case of women. In adults, there are various hormonal fluctuations which goes on in women such as PCOD, also known as polycystic ovarian disease or polycystic ovarian syndrome, hypothyroidism and so on. These hormonal changes causes disbalance in many systems of our body and skin. Now, how to identify if you're having acne because of PCOD or thyroid related issues? There are certain things, certain signs that you can look for in your body which can be a telltale sign, such as excessive hair loss or thinning of hair in the crown area, weight gain, jawline acne, facial hair growth, excessive pigmentation around the neck, underarms, etc. Fourth reason is stress. We all have stress and it is an unavoidable part of our lives today. Be it stress related to studies, job interviews, work, personal life, whatever. So stress can again dysregulate our hormones and cause formation of acne in those who are prone to it. Number 5 predisposing factor is dandruff. Some of us have very oily dandruff on our scalp, which is very difficult to get rid of. Again, it is a commonly associated factor with acne and with oily skin. Now, how to identify if your acne is because of your dandruff? Usually, the acne because of dandruff is mostly focused on the forehead, your chest, your back, or on your T-zone. It can also look just like whiteheads and nothing else. So if you have these kind of acne, look out for dandruff also on your scalp. Now, what do we do about these acne? Should you apply home remedies, go for treatment, apply over-the-counter products that you see in your advertisements? Well, if you let it sit on and do nothing about it, it is definitely going to leave scars and lifelong pigmentation. Or maybe it will increase and get worse further. So, you should definitely consult a doctor when you are suffering from acne. What treatment options are available as well as what home remedies you can opt for. I'll share all these and more in my next video. Hope this video was helpful. If you have any more queries about acne or its treatment, or if you think I missed out on something which you wanted to know, please leave your comments below and I'll be trying to answer these in my upcoming videos. Thank you so much for watching this video. Do like, subscribe my channel Rejuve Aesthetics and keep watching my videos. This is Dr. Sharadi Shreemoyee signing off. Bye.